we can learn in a collaborative way. And the study is very small, I mentioned, but we try to publish the data as well because it's a very interesting findings to search the prognostic factors and others. So our title is Survival Analysis of CNS Patients in Bangladesh, focusing multidisciplinary approach among 149 patients in a single center retrospective analysis from 2018 to 2023. Right. So the content of the study is introduction, methods, results, and conclusions. If we find the introduction of the brain, definitely it's a brain and other CNS tumors are the second most common cancer in adolescents and young adults, and represents eighth most common cancer in older adults. Average annual adjusted incidence rates of all tumors around 6%. 6 per 10,000 population in USA. We don't have any particular data, so we cannot give this. Most primary brain tumors are sporadic and without known cause. The pathological classification is a vital role to manage the brain tumor here. And CNS classification tumor is based on the World Health Organization classification of CNS tumor, first published in 1979 and last revised in 2021. We will discuss the 2021 WHO CNS version by one of our esteemed guests. So, how we diagnose the brain tumor? Definitely, it's a microscopic histology we need, followed by immunohistochemistry. Next generation sequencing is the prime now for the management of the brain tumor diagnosis as well as methylation profiling. I'm skipping. I'm keeping the WHO classification part because this will discussed wholly by our esteemed. Yeah. Focusing our study aims of this study was to evaluate the overall survival of patients with central nervous system malignancies in Bangladesh, especially in specialized hospital. The study seeks to identify key prognostic factors affecting survival outcomes, providing insights to improve diagnostic, therapeutic, and resource allocation strategies in low resource settings. The method is very clear. Central nervous tumor is a very variable survival status due to its location and age groups. We try to find selected CNS tumors among adult and child with trimetallurgy treatment and compare the survival and prognostic factors among 149 patients first time in Bangladesh. The data analysis was done. A model with Python created to analyze and the survival in the different groups. I would like to thank Mr. Fazul Haq Chaudhary for this prognostic Python platform to create. Kaplan-Meier survival analysis was used to estimate overall survival, and logarithm test was applied to compare the survival curves between different patient subgroups. Cox proportional hazard ratio regression was employed to assess the significance to potential prognostic factors on survival outcome. P-value less than 0.5 was considered significant. So among the 149 patients, the median age is 46.89. Most of the tumors, 52% is BDM. Further was astrocytoma, oligodendroglioma, and ependymoma as shown in percentage. The age ranging from 5 to 79 years age and male predominance 65%. The age group is divided as we use a variety of age group of patients. So we try to divide the age group in three categories: 1 to 18 children, that is 10%; 18 to 16 young adult, 71%; and above 60 senior adult, 19%. So the median overall survival was found 19.2 months. Confidence interval CI 95% confidence interval was 14.3 to 26.7, and male female gender ratio of survival is 17.9 versus 24.9 months. The individual histological median survival lowest in GBM 11.7 months and in astrocytoma 21.9 months. This is the Kaplan-Meier curve of the all age group. So this is quite for the long duration of months. And if we see the already mentioned that female has 24.4 months for the median survival, while the male is 17.3 months. And this is the Kaplan-Meier curve for the male sex group. This is an interesting findings that position of the tumor predominantly in the right side, 53.7%, where 70% of them achieved gross total resection due to the use of neuronavigation in our hospital, and 4% patients have only biopsy due to the location and inoperability. Higher location of tumor was found to have temporal, frontal, and parietal region, 62% together. Also, this is the Kaplan-Meier curve showing the median overall survival for the tumor location, and we found that temporal lobe has 10.47 together. The laterality already mentioned that predominantly right side we have some spinal tumors as well as central located tumor 7%. Median survival for the CNS patients different age group. I mentioned that it's a heterogeneous age group. So children has the highest as expected, 74 months. Young adult has the 22.4 months, but senior adult as expected it's very low, 7.73 months. And if we see the log rank p-test, we found that senior adult and young population has a significant p-value of interaction. And this is the Kaplan-Meier curve for the three age group. If we compare the histology with grading, the results of the median survival also similar like grade 4, like 11.7 months, whereas the grade 3 for 24.4 months. So it is expected as grade 4 is a less survival than the grade 3. This is the Kaplan-Meier curve for the grading. And for the histopathology, GBM predominant 52%, as well as grade 4 57% we show in the pie chart. And surgery type also plays an important role. We found that subtotal resection and gross total resection, that is the subtotal resection has 18.7 months, where gross total definitely 19 point more in favorable condition, 19.7 months. And near total group showed at the lowest survival, that is 5.4 months as expected in biopsy only group. So 23.5% of IDS mutation positive patient has better survival than 18.1% negative patient, that is 21.9 months versus 16 months, 16.6. So IDH, we cannot do the IDH for the whole group of patients, but we found that if IDH is mutated, then survival is definitely good. If we find out the surgery type already described, this is the Kaplan-Meier curve for the surgery group. And this is the graph. 105 patients we have done for the gross total resection, subtotal 26, near total 12, and biopsy only 6. This is called proportional hazard ratio. We find that it is a strong predominator. Histopathology also a high value of p-value. Tumor grade also play an important role, though we cannot find sex, surgery type, and IDS mutation type any significance, but we understand that IDS plays an important role right now. Radiotherapy have definitely a role because it's a trimodality treatment. So the patient who received radiotherapy had a median survival of 27.5 months and significant higher those who did not receive radiotherapy. In previous slide, we are describing how much dose we applied for 149 patients. Among 149 patients, 106 received the higher dose and 22 received the 54 gray, probably for the astrocytoma or other cases. Some of patients cannot tolerate and some of patients did not receive the radiation as well. And most of the patients received concurrent temozolomide as well as PCB. So the analysis is little complicated in case of heterogeneous histology and location of the CNS tumor. but with the model that created by Python showing significant relationship and survival outcome. If the sample size also increase in number and the single histology selected to find out the comparison with other parameters, then the best survival outcomes can be estimated. Thank you for your patience, Harry.